Hello, welcome. Welcome to this WHO webinar on ending the neglect to attain the Sustainable Development Goals, a framework for monitoring and evaluating progress of the roadmap for neglected tropical diseases 2021 to 2030. We are very excited to be linked with you around the planet today in order to familiarize you with this document, which is a framework really to understand how we're making progress around the WHO roadmap that was launched earlier in 2021. Today, during this webinar, we'll have a couple of different sections in order to bring you up to speed with us. I'm Julie Jacobson. I am the chair of the WHO STAG NTD Monitoring and Evaluation and Research Working Group, and very happy to be here introducing you to this framework that has come through a lot of hard work of the WHO Secretariat and many other partners that have put a lot of work and time into helping pull together around 20 different, the 20 different NTDs, this piece to help us follow our progress more closely. So this webinar is for you. It is for all of you that are watching it live today. Next, I would like to bring us to our fearless leader, Dr. Mwele Malachela, and we're very happy that she is here with us today to give in her own words an introduction to the framework that we will be discussing today. So over to you, Mwele Malachela, Director of the NTD Department at WHO.
Good morning, good afternoon, and good evening, everyone. Thank you very much for joining us today. As many of you will know, the new NTD roadmap was launched in January of this year, and I'm happy to say that the reaction was overwhelmingly positive. This flagship document is a result of the collaboration and input from our entire NTD community. It includes and reflects the voices, opinions, and aspirations of all who contributed to it. You will be familiar, I'm sure, with the content, but with your permission and given the importance in today's webinar, I'll provide a brief reminder of the new roadmap's fundamental shifts. The first important shift is to move from measuring process to measuring impact. This is vital. It means that we focus on accountability so that we know what gets measured gets done. We have a vision of where we want to be. Now we continue the journey together. Secondly, our focus in the coming years must be on combining our efforts and involving people and partners in meaningful ways. This means a shift from top-down planning and programming to collaborative work across sectors in the service of these common goals. And thirdly, the shift from partner-driven programming to country-driven programs means that all our initiatives will be focused on the areas and communities that most need interventions, and that they reflect the needs on the ground rather than reflecting policy decisions that are made at a distance. Monitoring and evaluation has been recognized as one of the 4 most common gaps across diseases, and it warrants accelerated programmatic action to reach the goals that are set in the roadmap. So the monitoring and evaluation framework that we're discussing today embodies the roadmap's key shifts towards impact, integration, and country ownership. It is a clear call to action to countries and implementing partners. Its fully defined operational impact indicators for greater accountability and action start at the country level and provide guidance on mainstreaming the monitoring and evaluation of neglected tropical diseases within countries' health information systems. The framework emphasizes too that monitoring and evaluation are integral components of all our interventions against neglected tropical diseases. Also highlighting within the monitoring and evaluation framework is the importance of standardizing indicators and defining the core set, as well as additional indicators, to ensure comparability, not only across the different implementation level, but across countries too. Crucially, the M&E framework aligns with the WHO's vision of strengthening national information systems and contributes to building a World Health Data Hub at the global level. We know that major gaps remain, however. So the M&E framework also contains a section on looking to the future and identifying gaps and research needs in order to further strengthen our monitoring and evaluation processes. It is vital that we continue to adapt, progress, and improve. So accordingly, this framework will remain a living document to support national programs, and it will be updated periodically with new evidence and experience. I do not think it's an exaggeration to say that this framework is critically important for the success of the roadmaps and our hopes of achieving the 2030 targets. I want to extend my grateful thanks to all who have supported this process to date and all of you who've worked tirelessly in pursuit of our ultimate goal to free billions of people the world over from the burdens of suffering and economic restriction. I wish you all a productive and engaging webinar. I thank you.
Thank you, Mwele, for those important words that remind us of the task at hand that we have, and to the reminder also that this is a living document and a living process that we will continually refine as we move forward. I would like to invite Somnath Chatterjee. Somnath is the Senior Advisor for the WHO Division of Data Analytics and Delivery, otherwise known as DDI, and ask him for some comments, as well as his work focuses on strengthening country health information systems, data generation, and evidence creation, and that is core to the task that we have in front of us today. So Somnath, over to you.
Thanks very much, Julie, and welcome everyone to this very important webinar on the monitoring and evaluation of neglected tropical diseases. As several of you know, WHO is committed to making a measurable impact on the lives of people we serve. The operative phrase here being measurable impact. Right? So whatever we want to do must have an impact on the lives of people, and that impact must be measurable. In other words, we must be able to track this progress and make course corrections as needed. Also, the term neglected tropical diseases raises another very important issue to which we are committed, which is whatever progress we make in the Sustainable Development Goals must be equitable, which means that these people who suffer from neglected tropical diseases are perhaps the most vulnerable people. So we must ensure that whatever progress is made towards SDG 335 is done in an equitable manner, and that we track whether this progress is indeed happening equitably through the monitoring of inequality. As has been mentioned in the metadata for that particular indicator 335 related to the eradication of, amongst other things, neglected tropical diseases. Not only are neglected tropical diseases related to many of the other SDGs beyond 3.3, but also it actually talks about the need that we have to work in partnership to support countries through the entire value chain, right from data generation to data analysis, to data storage, to data sharing and use, which means in order to be truly able to deliver impact on the lives of people, we cannot do this alone. This has to be done in collaboration and partnership. As Muele mentioned in her introduction, what are we trying to do to solve that problem? What we are attempting to do is to build this end-to-end process, right from data generation to use and dissemination, and in an attempt to create these partnerships and collaborations through the World Health Data Hub. The World Health Data Hub is our end-to-end solution to be able to create these partnerships, to be able to create these collaborations, so that it's not just experts who are trying to inform the monitoring and evaluation process, but we engage all stakeholders in this exercise, and we draw on insights which can actually come only from the ground. Not only is it important for us to build collaborations across the world, but it's also very important for us to build collaborations within the organization. So what are we doing there? We have built a hub and spoke model where DDI, as the division responsible for tracking the health-related SDGs, also works with all the technical programs which serve as our spokes, so that we truly create a partnership which is underpinned by data governance and by a mechanism which is underpinned by these common standards. So the idea of this whole exercise of monitoring and evaluation is that it fits within the larger global data ecosystem. So what that really means is we have to work together, and what is happening within the division and across is we have built the Health Data Collaborative, which is a partnership across not just the UN organizations, but many, many, many different stakeholders representing all their different groups. And together, I think what we need to do is to be able to work so that we can make a difference that we want. Thank you.
Thank you, Somnath. Appreciate those wise words and the importance of equity, the importance of the use of data, and the idea that we're in a new generation of mainstreaming the NTD data into the WHO Data Hub. And we will have to actively follow this as we move forward. I want to remind us that the leading document for us is the WHO roadmap on NTDs. And the team has put together, unbelievably, a 1-minute video that introduces us and summarizes this. And so let's move to that video and see that as a reference point before we move forward with the framework. Thank you. that was really impressive. And it shows the diversity of the populations that we're trying to reach and that we need to be able to follow to be able to see if we're making the progress that we need to in order to be able to achieve the goals of the roadmap. Next, we're going to move to having some thoughts on the M&E framework itself from people who have been very closely associated with the development of it and across the regions of WHO. So can we move now to hearing from our regional colleagues?
This framework is a call to action to countries and implementing partners for greater accountability and impact-oriented action, starting at the implementation level in countries. The primary target audience for this framework is professionals working in the area of NTD services planning and implementation, health systems and health information systems at both national and international levels, policymakers, managers, and researchers working within and beyond the health sector.
NTDs are recognized as a target for global action in Target 3.3 of Sustainable Development Goal. This framework presents a theory of change which defines key actions. Progress must be made towards various intermediate outcomes within countries, such as affected population be sufficiently covered by priority services, or populations being appropriately protected from the risk factors. Increased access will result from accelerating programmatic action at both global and national level. These changes must take place within all countries in which NTD are endemic in order to achieve the roadmap goals. M&E framework tool has changed the approach to monitoring and evaluation in 3 specific ways. Concurrent tracking of implementation indicator within the country-level program also remain key to the collective achievement of the roadmap impact and target. Where appropriate, monitoring and evaluation of endemic NTD should be integrated into common platforms. Integration should also be promoted for the different data processes and at the different level of the health information system. Mainstreaming NTD data into the National Health Information System and building capacity to manage data process are also important in contributing to the sustainable and efficient monitoring and evaluation of. This framework encourages a shift from externally driven agenda to stronger country ownership and financing of NTD program activities, including monitoring and evaluation, and information system to primarily meet the needs of the evidence-based decision-making and reporting in alignment with its national priorities.
Consequently, the M&E framework presents the key components for building, maintaining, and sustaining a fully comprehensive and integrated process to report on the roadmap targets and structure in 5 sections after the introduction. Section 2 describes the guiding conceptual framework and strategic shifts of the M&E framework. Section 3 focuses on quantitative monitoring, that is, how to collect, analyze, report, and use the quantitative indicators set forth in the roadmap. Section 4 focuses on the qualitative monitoring and presents the gap assessment tool. Section 5 highlights the evaluation of progress towards 2030 roadmap targets. And Section 6 looks forward and highlights gaps and calls for solutions. The M&E framework presents the linkages between the existing tracking of the NTD indicators, which were continued under the new roadmap, and tracking the new roadmap targets, many of which are built upon the existing indicators. The framework presents 36 core quantitative indicators and 34 additional disease-specific indicators. These indicators will guide global reporting on progress towards attainment of the NTD roadmap goals. Notably, cross-cutting indicators will also support tracking of the sustainability of the NTD programs. Additional country-level indicators, some of which are new, are introduced by the roadmap and described in the compendium of indicators. Countries will continue to monitor existing programmatic indicators at the country level.
While distributed across different levels, the quantitative indicators presented in the roadmap do not systematically cover the full spectrum of the theory of change for monitoring and evaluation for NTD programs. Based on their disease endemicity, national NTD programs should therefore continue to monitor indicators that measure each of the components of the theory of change in their respective contexts, using 4 major indicator domains, namely health status, health information systems, service coverage, and risk factors. The overarching and disease-specific indicators included in the roadmap are intentionally focused on measuring primarily high-level results, such as impact or outcome. However, this also further varies by disease according to the maturity of the program. Less mature disease programs, example mycetoma, chromoblastomycosis, and other deep mycosis, will monitor inputs, whereas more advanced disease programs, such as dracunculiasis, lymphatic filariasis, can monitor outcomes and no impact at the global level. End of the indicators has a reference sheet. Compiled together, these reference sheets comprise the indicator compendium, which provides a comprehensive and standardized listing of recommended NTD roadmap indicators. Each indicator reference sheet provides detailed metadata, thereby improving the degree of internal consistency, standardized measurement, estimation methods, and enabling comparability of data obtained across countries to allow comparisons and coherence. The NTD indicator compendium will be updated regularly based on technical developments and made accessible online as a living document.
Broad drivers of success in NTD programs are often more readily assessed using qualitative methods. The M&E framework builds on this qualitative assessment to create a new gap assessment tool for NTDs to improve qualitative monitoring and to identify focused actions for course correction as needed throughout the next decade. The majority of the data for tracking progress against the roadmap targets will flow through national data information systems where they will be validated, compiled, analyzed, and used for decision-making at each supervisory level. For effective program ownership and management, these data processes should be present to some extent at all levels, although certain processes will be more prominent at some levels than others. Countries should be supported to be the primary and first users of data collected from their national NTD program activities. WHO is working to solve challenges of data fragmentation and data silos faced at multiple levels of the global data architecture by consolidating WHO's data repositories, portals, and datasets, and reducing the burden of data collection on countries. It is envisioned that member states will ultimately report NTD data, including roadmap data, to WHO through a forthcoming country portal in the World Health Data Hub.
Although NTD data sharing and management practices have improved, for some diseases programs, this has not been sufficient to achieve high data quality and efficient data use across all the NTDs. But despite these challenges, impressive public health gains have been reliably validated, verified, or certified through independent committees. This M&E framework incorporates an accountability timeline to support policy dialogue actions at country, regional, and global levels. Substantive evaluation of progress against the 2030 NTD targets shall be conducted in 2022, 2024, 2026, and 2031, as well as in 2029. WHO will provide to the World Health Assembly a comprehensive report of periodic evaluation based on the report from countries and stakeholders. Countries need to submit timely and complete reports to enable global reporting as per this timeline.
Attaining and maintaining progress towards the roadmap cross-cutting targets will provide an indication of the sustainability of national NTD programs along the 6 health system pillars, which are leadership and governance, access to essential medicines and supplies, service delivery, health financing, health workforce, and finally, health information systems. In this monitoring and evaluation framework, evaluation is defined as the periodic systematic assessment of expected and achieved progress towards established goals, analyzing data and health status to determine if the program is on track, and if not, what actions may be needed for course correction. It is therefore important to use methodological approaches that allow evaluation teams to balance accountability and learning among stakeholders. Evaluations should examine the relevance, effectiveness, efficiency, and sustainability of the interventions, the contributions of stakeholders at both national, regional, and global level, and provide evidence that is reliable, useful, and timely for decision-making and management. The NTD heat map developed for the roadmap demonstrated that at least half of the 20 diseases and disease groups require critical advances in monitoring and evaluation. In some cases, these gaps are substantial, including a need to add disease-specific impact indicators to the existing NTD indicator compendium. In others, countries need support and the use of new indicators to measure cross-cutting approaches, or the use of new qualitative methods such as the gap assessment tool. A rapidly expanding programmatic focus on morbidity management and disability prevention will also necessitate the development of indicators to monitor stigmatization and equity as part of the M&E framework.
Monitoring and evaluation frameworks are dynamic and require periodic assessment to strengthen them in order to maintain their utility and relevance. As a living document, this framework will identify gaps and weaknesses. Key indicators will be updated where needed. As it is used to support the development of comprehensive monitoring and evaluation components in national NTD plans, it will generate new learning. Importantly, this framework forms the basis for formulating realistic costing plans to meet monitoring and evaluation needs. Management of the required research work will be guided by WHO's Working Group on Monitoring, Evaluation, and Research under the auspices of the Strategic Technical Advisory Group for Neglected Tropical Diseases.
Well, thank you for all of those in-depth introduction and thoughts on how the framework can be useful at the country level and what the framework is trying to do. We're now going to move into a more interactive piece of the webinar, and I want to remind you that through Slido, you can put questions that will go to the panelists. So if we can remind people about how to use the Slido and Could we put up the slide for that? Is that possible, Simon? Just to quickly show people how to get onto slide. Meritrell Donadue from the University of Melbourne, who is a member of the Monitoring, Evaluation, and Research Working Group. And then we have Pat Lammy, who's the director of the NTD Support Center at the Task Force for Global Health, and also chairs the WHO's Diagnostic and Technical Advisory Group. So welcome to you all, and thank you for being here as resources to your colleagues and partners that are with us today on the webinar. My first question I would like to pose to you, Gautam. We have a lot of indicators, as has been pointed out in the opening here, and a lot of diseases, 20 diseases across the full spectrum of what we have. And we also have a very long document, understanding that it's a lot of indicators and a lot of diseases, it's necessarily complex. And so the big piece that I would think would be helpful to hear from you is, what do you really want the audience to know from this webinar? Where should people go if they have questions that they need to respond to after the webinar? What is the main thing you want people to understand when they leave this? You're on mute. You're the first one.
This is a new skill we all have to learn, mute and unmute. Thank you, Julie, and good morning, good afternoon, and good evening to all colleagues and participants. Hope you're all doing well and keeping safe. Julie, the primary aim of this technical webinar is to introduce the monitoring evaluation framework. And many of us here are its potential users and have an interest or responsibility in the implementation of the roadmap and its monitoring and evaluation. As Dr. Malachela mentioned in her inaugural address, monitoring and evaluation has been identified as one of the 4 important or major gaps that is likely to constrain the achievement of the roadmap's targets. Now, the framework, which is already accessible through the WHO NTD website and also through the NTD Roadmap app, which is both available as an iOS and Android versions, will also be available in other UN languages. Currently, it is only in English, but very soon we will have all the other UN languages. 2 additional documents, an indicator compendium, it was referred to by some of my colleagues, and a health facility data toolkit, as mentioned in the framework, will also be available to support the decision-making process. Now, comments or questions can be sent through the generic email, which is ntdroadmap@who.int, or through the NTD Roadmap app. And I think my colleague will put up these links on the chat box so that you can make a note of it. I would say that this framework is a building block for strengthening the monitoring and evaluation of interventions and their impact on NTDs. Today, we have an opportunity to convey the message that monitoring and evaluation should be an integral part of NTD interventions and not an afterthought for meeting dossier requirements or reporting to WHO partners, but mainly to make the decisions at the places of implementation, starting as low as the districts themselves. My message to those involved in program implementation is to look into the respective areas of work, and this could be at national, state or province, or even at district level. If they can start considering the NTDs that are prevalent and look into current methods of monitoring, how is data currently collected and used for decision-making, that would make a perfect base for a start towards strengthening monitoring and evaluation components of their national NTD plan. From a national perspective, countries can seek technical assistance through their WHO country and regional offices. We look forward to hearing from stakeholders on the gaps and needs, especially from those implementing programs, and monitor its progress, as well as from those sectors like WASH, One Health, vector control, which have a strong influence on NTD outcomes. This will help WHO and partners to provide guidance and recommend solutions towards equitable, effective, and efficient program implementation and achievement of the 2030 roadmap targets. So I hope I have answered your question, Julie, but would be happy to take supplementary questions. Over to you.
Thanks, Gautam. Yeah, very helpful context. And I really appreciate the resources to help people know, even after the webinar, where they can receive input and direction from the team as they're trying to put this framework into play. I'd like to move to Meritrell Donadieu from the University of Melbourne. And Meritrell and I will both be tomorrow, again, at this early hour for me, late hour for her, on the working group itself. So I want to just make note to people as they are putting in questions that can't be answered here, or questions that should be considered by the monitoring and evaluation working group, we can bring into the discussion that's going to be happening there. Because as has been mentioned, this is a living document. Meritrell, the framework is really highlighting the role of intersectoral collaboration, and that importance of that we really need to have to accelerate our progress towards attaining the goals that we have. So my question to you is, what opportunities already exist in M&E practices across the sectors beyond health that could help support reporting on the M&E framework indicators? Do we have to start from scratch, or are there tools that we can pull from?
Thanks, Julie, and hello, everybody. There are a lot of opportunities on different sectors, and we really need to take the opportunities. We really need to maximize these opportunities to minimize to decrease the burden of the work on M&E, especially at country level. Now, these opportunities, they will vary depending on the sector that we're talking, and also depending at the level that we are talking. So, for example, if we talk about WASH, a very important sector, there's already quite a lot of good collaboration at global level. And even at country and program level, there are some very good examples. For example, in Cambodia and in Laos, they are working together, the WASH system and the schistosomiasis program, and they report together. So those are very good examples, but they are very limited. So what we need to do is to learn from that and see how we can expand in those good examples. Another one, for example, if we talk more about the One Health, there are some collaboration, for example, with rabies. There's already a very good collaboration with the OIE, that's the World Organization for Animal Health, and the WHO. There's already change of data. And if we look at country level, in many countries, there's a good collaboration between the Ministry of Agriculture and the Ministry of Health. Now, however, that for some other diseases that are not so visible or not as as tangible as rabies, if we talk about some of the neglected parasitic diseases like teniasis and cysticercosis, this communication is very limited. There's no integration. So there's that opportunity to increase that dialogue that has already started between the Ministry of Agriculture and the Ministry of Health. There's an opportunity to build in what is already existing, for example, for rabies, to increase to the other diseases. And I'm sure that there are many good examples around the globe and about the different programs, and we really need to pick up those good examples and learn from them and maximize those opportunities. There are good things going on, and we need to take advantage of those ones.
Thank you. I think that's a really important reminder for us as we think about this putting the framework into play, that we don't have to start from scratch. We have colleagues that have been working on some of these indicators and have expertise in these areas from the cross sectors that we need to collaborate and work with and build this strong M&E framework, pulling in the data that is already there and really creating those collaborations and intersectoral connections. It's been mentioned many times about this being a living document, and I think part of the pieces of this, and I'm going to move to you, Pat, for the next question. We have, you are in a unique position here. You've been very supportive of the creation of the M&E framework document and supporting that in the back. And also you're the chair of the diagnostic working group. And as we know, new tools are going to need to be developed in order for us to be able to move forward to the 2030 goals. And my question for you is really about what are the key areas for research investment and where immediate action is needed in the short term to support programs as you see it.
And thanks a lot, Julie. And good morning, good evening, good afternoon, everyone. It's really a pleasure to be here and to see focus on M&E, a topic which has been near and dear to my heart for many years. I think that as many have noted today, with the living document, there really is a focus on continuous action to continuous engagement and research, which I think is implicit in improving the M&E framework to support the roadmap goals. I could call out a very long list of priorities. I'm going to focus on three, which I think are particularly important, which have been called out, I think, by some of the previous speakers as well. Harmonization, I think, is really the first one that I want to start with. We have 20 NTDs, we have 20 different frameworks. It's really going to be important for you as the chair of the MER working group to start looking across the indicators and definitions to make sure that for each disease, we're using these in similar ways. And to the extent possible, I think it's important for us to start using similar assessment methodologies, survey methodologies, in order to help improve the collection of data, to facilitate integration across diseases, but also to make the process easier at the country level. The second point, which I think is what is really going to be important for our two working groups, is really surveillance. When you look at the heat map, and in particular, for those of you who are going to be focused on looking at the document, Annex 1 of the document provides a very nice summary of the M&E needs across diseases. Almost all of those diseases mention surveillance as a need. And I think, again, with the focus on looking across diseases, what that means for the future is we need to be concentrated on integrated surveillance, which will put a special burden on the M&E working group in terms of looking at integrated surveillance methodologies. We're not going to get there in terms of the quality of our surveillance data unless we bring new diagnostic tools online. And this is where I hope our two working groups can really work effectively together. If you can't measure it, you're not going to be able to improve it. And I think that that's something that has been mentioned by others as well. I think the third issue, which I'm going to focus on as an area where I think immediate attention is needed, is really related to the previous two, and that's the evaluation methodology. We've heard today about the new quantitative and qualitative assessment methodologies. It's going to be really important for the community to understand how to use these tools effectively in order to guide their programs. So I think a long-winded answer, Julie, but I'm going to again return to the idea that harmonization, surveillance, and evaluation are the three specific areas where I hope we're going to be able to concentrate our attention. Back to you.
Could you please share more information on how the cross-cutting indicators are meant to measure and promote sustainability? So really, how does the cross-cutting elements promote sustainability of NTD programs as they carry through that theme of integration and impact?
Okay, so I think if one of the challenge while we were framing the indicators was not to create a long list of indicators and put a lot of burden on the countries to collect. So the 36 core indicators, as we call them, 4 of them are overarching. And then there are 10 cross-cutting, which have some elements like, which are also built into the sustainability framework that has the country included the plans for NTD within the national health plans. Has there been domestic financing and to what extent? So there are 3 or 4 indicators which were in the core indicators, which in our mind also measure the sustainability aspect of the program. So that's how the cross-cutting indicators aim to also measure the sustainability part of the programs. And as I mentioned, I think when we were doing the sustainability framework, there was a lot of tension in should we add more indicators to measure sustainability, and we kind of withheld because just not to overburden countries to ask for many indicators. The other good thing that is yet not included as indicators, there are many aspects which are already being measured by the countries in their health information or HMIS systems, which could provide information on the sustainability of these programs, for example, the health manpower availability and other things. So those could be also elements that we could use without collecting additionally, but making their use into our assessment. Over to you.
Mayor Trell, any thoughts on this question as well?
Yes, actually, I think it's a very good question, because I think that the cross-cutting indicators really can help to promote the sustainability by helping to bring home the message to the other sectors. Sometimes some of the sectors, they feel a bit away from the neglected diseases. So having common indicators and indicators that impact all of them, I think that really will help to bring the other sectors into the agenda. And if the other sectors really take their responsibilities and take their role more serious, then really will have an influence on the sustainability of the program, on the sustainability of the actions. So I think it's very important to have these cross-cutting indicators and involving the other sectors, because yes, that will help with their buy-in, with taking the responsibilities and taking the action. So I think that's very good.
Excellent.
Julie, can I just come back on one point? Sorry to...
Certainly.
Yeah. So one of the things I think, just following up on Merit's point, and one of the key things was, for example, the WASH indicator. And there was again this tension of, okay, should then now the NTD programs should start collecting or measuring WASH implementation? And the answer clearly is no. They have to, as Merit said, I mean, the WASH group is already measuring indicators for how the implementation on the WASH side is happening. I think here, the important thing on the cross-cutting side is to match, does the progress in WASH matching the epidemiology of the NTD? Are they related? Can we make a case for prioritization of WASH activities in areas which are which have NTDs. So these are the areas that we believe the cross-cutting indicators, without additional inputs or efforts, can benefit both the sustainability as well as the other aspects which impact NTDs.
So we have another question that's come in that is related to the sustainability kind of question, but more from a data standpoint. And it's related to a question that also came in for Somnath. So if he could be prepared to jump in here as well. And this question is pertinent, I think, for this panel, but also potentially for the panel with the countries themselves. And so I may repeat it again for them when we get there. Most countries don't have their M&E systems embedded into the mainstream national reporting. And I believe this is one of the steps to country ownership and likely to sustainability. So what is the current thinking on how to integrate those data systems? And then, and Somnath, there was a question that specifically brought in the pieces of the integration of the NTD data into the WHO data hub and how that complements ESPN data. So maybe Gautam, you could take on the piece of the country level data. And I don't know if Pat, you'd have any comments on that, and then Somnath on the kind of how the global data and links to the ESPN and the WHO data hub.
Somnath, you want to go first?
Yeah, sure. Thanks, Gautam, and thanks, Julie, and thanks for that, thanks for that question. So the idea of the World Health Data Hub is really for us to bring all data assets into a single repository, which is then appropriately documented with all its metadata, and then harmonize these data sets and be able to provide access to people perhaps in a tiered manner. So there may be some data sets which are not necessarily public, but may be available to a collaborative group of people for analyses. There may be other data sets which may be more widely shareable, which we can disseminate with the appropriate material. So really the idea is to be able to reduce these friction costs, as I call them, as much as possible, right from the data which is being generated by countries, as Gautam said, avoid duplication and burden on countries in terms of reporting, and create a common data set that everybody can work off. Not necessarily, data which is, again, as Gautam alluded to, necessarily being generated by the NTD program, but maybe data that's being generated by other programs, as Gautam mentioned, for example, for WASH, as part of the joint monitoring program. But once these data assets are all in one place, appropriately documented, and can seamlessly talk to each other, I think that will bring value to this exercise.
Thank you. Thank you. And I think that emphasizes Meritrell's points from earlier in the cross collaboration pieces and using existing data sources and trying to create those links. Gautam, any thoughts on the national level?
Yeah, the first thing is we need to realize that that's the way to go. Because if we don't, then we will find different reasons for doing things in parallel. I will just give you a couple of examples. And many of the diseases are targeted for elimination, and for example, for LF, lymphedema and its management is one thing that the countries are expected to demonstrate that they are looking for them and providing support to them or taking care of them. Now, in many countries which are endemic for LF, you will be surprised to see that in their HMIS, they have a column for lymphedema. But unfortunately, even in the areas which are highly prevalent for lymphedema, the number there is put as 0, or a blank. So what is happening is that there has been, an effort to put things in the HMIS, but because we are not utilizing it and we are, and we're not looking at it, we are creating another parallel mechanism. And this is both not efficient and also, it's defeating the whole purpose of bringing it together, because then the dossier preparation for the country would become much more easier if all that information is there. The other example I would like to share is from the Guinea surveillance. I think one of the last phases, that when the country had to demonstrate that for 3 years there is no cases, one of the things most countries fell back on was on their, the information system or things. And I've seen when the evaluation teams have gone there and they say, okay, that's very fine, but when you had 100 cases of Guinea worm, your reporting system was reporting 0. So how can we, we can value the 0 in this now? So I think it's also harmonizing this information, which is collected through different ways, but is not being put into one channel. I mean, these were two examples, but I think there are many opportunities that we could use. I think that harmonization is a very favorite topic of yours. And because we keep data in different ways, different metadata, we try to understand how the different disease programs are defining endemicity. And we were surprised to see that there were so many different ways of defining endemicity. So one of the tasks that we are trying to do together in the department now is to standardize these definitions on endemicity and all that. And that can be more facilitated with this, having a strong core information system. We, at the same time, we do realize it will not happen overnight, but I think if we think in that direction, that is to us the way to go and the more efficient way of doing things.
Thank you, Gautam. Yeah, very important thoughts. And I think as we hear all of this, it brings us into our second panel that we're going to have. So thank you to this panel for your thoughts, and we're going to be moving on to the next panel. But before we do that, we have a short video to see to bring us into the next section of our webinar. Over to the video. Together towards 2030, and Together towards 2030 perfectly brings us into our second panel, which is really on implementing the framework. And we have several people with us here from different countries around the world. And I'm going to go through and just ask each one of you a question, then we'll come back to questions more generally across each of the participants in this panel. We have Lucine Paranonia, who is from the Department of Zoonotic and Parasitic Diseases at the Center for Disease Control, the Ministry of Health in Armenia. Welcome, Lucine. Thank you for being with us today. From the perspective of Armenia, how well prepared is the country to monitor and report on the NTD roadmap for 2030 goals for the diseases that are endemic in your setting?
Dear colleagues, Neglected tropical diseases historically caused major public health problems in Armenia, where lepra, trachoma, leishmaniasis, rabies, echinococcosis, tenidosis, and soil-transmitted helminthiasis, scabies, and snake bites were endemic. Currently, lepra and trachoma are not registered. Notification of neglected tropical diseases as other infectious diseases is mandatory. Surveillance system is population-based, passive, and case-based. The NCDs of Ministry of Health analyze and interpret the data, followed by decision for corrective actions. Some of NTDs, such as leishmaniasis, rabies, are included in the list of diseases requiring immediate notification to the MOH. The others are requiring urgent notification within 24 hours. Epidemiological investigations of all the cases are conducted by local epidemiologists and parasitologists. Epidemiological surveillance of leishmaniasis, rabies, and helminthiasis are regulated by the sanitary epidemiological norms and rules, which clarifies the standard case definitions and emphasize the functions and responsibilities of each level of public health system to control the diseases. NTDs, when they are registered in children up to 18 years old, they are diagnosed and treated by state order free of charge for the patients. All preventive and anti-epidemic measures in foci, which are regulated by MOH order, such as contacts and environmental laboratory investigations, entomological surveillance, and vector control measures, again conducted by NCDC regional branches within the state order. Zoonotic diseases in animals are among notifiable diseases also. Case definitions and standard operating protocols are implemented. According to the government decision, meat and other products are subject of veterinary examination. The procedure for the exchange of information between the Ministry of Health and Veterinary Service has been approved. However, we also face problems with the neglecting of these diseases and mostly with data collection. There is a big problem with data from private laboratories and medical facilities, which, in spite of regulations, not always inform the cases. For example, surveillance of cystic echinococcosis is based only on the notification of cases of surgical interventions. The real prevalence of alveolococcosis is unknown, as medical centers do not report cases at all. However, for example, in 2019, as a result of active epidemiological investigation, 11 cases of alveolococcosis have been detected. Also for tenidosis, we register 75% of cases among urban population, and it is due to availability of laboratory investigations. And in spite of all the regulations, there are no data on animal examination for the last 5 years. From soil-transmitted helminthiasis in Armenia, ascaridosis causes the main concern for us. Its prevalence around 10%, but prevalence increases when active screening is conducted. We had this kind of surveys among children in 2015, 2016, and can compare the data. For leishmaniasis, from 1999 to 2021, there were 202 indigenous cases with 7 fatal due to late hospitalization and treatment. Due to improvement of surveillance system, adapting of WHO guidelines and series of trainings. Now we consider that surveillance system is improved, the sensitivity of our surveillance system is improved. And also we are very grateful for WHO support for rapid diagnostic tests and medicines for the treatment, which helps very much on case detection.
Very, very, very helpful. And I'm noting a couple of the very interesting tools that you've brought into play. So the use of using the notifiable disease system has been very important. The linking across disease programs within the Ministry of Health has been very interesting. And the care provided directly from the government to support patient care. And the challenges with private sector collaboration. I think that's a key, that sounds like a key piece. And also this interesting piece of the combining the data sources from active and passive surveillance screening sources and how you bring that into your data system. It sounds like a very dynamic program and a lot going on there, so it must keep you very busy.
Yes, that's it. All the diseases that are endemic in country have their specific gaps in epidemiological surveillance and that need to be improved, and sensitivity of the surveillance system needs to be improved in terms of better diagnostics and notification. NTD roadmap indicators can help to improve our surveillance system of NTDs and ensure the sustainability of actions needed to meet the 2030 goals. We think, however, we think that from our perspective, the country is quite well prepared to monitor and report on the NTDs roadmaps, goals, and facilitate in improvement of epidemiological situation of NTDs by sharing experiences, the best practices, etc.
It sounds like we have a lot to learn, and we'll from Armenia's experience, and we'll continue to be engaged. So thank you for bringing up some of those really important points. We're going to switch now over to another part of the planet, moving over to Indonesia, and we have Wita Larisita with us from ACT to End NTDs East with RTI International. Wita, how is ACT East an implementing partner helping the information system for NTD programs to align with the new M&E framework?
Thank you, Julie. Actually, ACT East is the only funding partner for national LF program in Indonesia. So ACT East has been designed in part to strengthen M&E within the national LF elimination program. The project actually started in 2019, although it's the continuation of the previous project, namely Envision, which has started to support LF program in 2012 with USA funding. Our focus is limited because the objective of our project is determined by our donor in consultation with TMOH. We have been working with LF and SCH unit under DG of CDC in various activities, like LF mapping to determine endemicity in more than 70 districts, MDA in over 50 districts, many DSA or disease-specific assessments, included pre-transmission assessment survey and transmission assessment survey. We did post-MDA coverage survey. We also did capacity building through trainings for microscopists and for touch supervisors for the subnational levels. We also established earlier NTD database since 2015 to strengthen and complement to the existing LF database in LF SDH unit. Contains the LF historical data from 2002. Lastly, we are assisting in preparation for dossier data, starting with completing good quality of LF mapping data. I think that is all that we did for over 8 years, beginning in 2012. Thank you.
Thank you for that. That sounds like a lot. And I want to jump now back to Didik Bujanto. Didik is with the national program. He's the director of the Vector-Borne and Zoonotic Disease Prevention Ministry of Health at Indonesia. And he has been a champion of One Health and well recognized for his role within that. Very active during the pandemic time. So welcome, Didik, to you, and thank you for making time to be with us today. My question for you is, how is Indonesia making decisions based on the M&E information available for the 10 endemic NTDs in the country?
Thanks, Julie, for the opportunity. First of all, I would like to congratulate WHO for finalizing and launching the new M&E framework in NTDs area of work. I believe this new framework will be useful and provide benefit to all member states in accelerating in the elimination and eradication of NTDs. I'd like also to reform our commitment and close engagement towards meeting the national, regional, and global target on NTDs. You may be aware that Indonesia is the largest archipelago and the fourth most populous country in the world. And the country has decentralization system, and we have at least 10 entities that endemic, with 2 of them are considered as outbreak-prone disease that are dengue and rabies. With this situation, the main challenge are the timeline and the completeness of the reported data from subnational level. Both aspects have a significant impact in outbreak response and the MDA plan for disease that need preventive chemotherapy. To create evidence-based decision, we have been trying some approach, not only improving our health management information system by developing real-time data reporting system, but also our engagement with the local government and community. I think, yeah. For the outbreak-prone disease, the community participation plays a significant role in the detecting outbreak. We try to open several channels for the community, including the utilization of social media such as Facebook and Instagram. Dengue and rabies are diseases that may harm people's life, potentially become outbreak in certain area. Dengue and rabies, with the close collaboration with community, we are trying to work faster in responding any outbreak response reported from the field. On the other hand, for PC intervention, we are trying to improve the quality of reported data entry every year. Yeah. Starting this year, we will carry out a coverage survey to validate the reported data from all districts that implement triple drug MDA for LF. We have also developed an information system for filariasis, SDH, and schistosomiasis called eFilcha. And we have been operating the system since 2018. The system is useful not only for reporting and data recording, but also for data storage and preparation for two-phase dossiers process in the near future. Finally, to conclude my statement, I understand that integration will be spirit of the new M&A framework. The integration, it may be easy to say, but will be extremely difficult to be implemented. We will try our best in Indonesia to adapt this new framework. There is an idea to develop one VBDC, vector-borne disease control data that will provide key indicator in each disease into a dashboard. I believe that this will be a good point to start the integration in the equation. And I would also like to thank all entities various in Indonesia as well as a member of the community for continuing the work hand in hand to realize the noble goal of entity elimination and eradication in Indonesia by 2030. Thank you. Over to you.
Thank you, Didik. I think really important to highlight that there are challenges ahead, and specifically when it comes to integration, as you said, and that we're in this together in figuring it out. So it's not up to anyone alone to carry that burden and the challenge of that. And I think thank you also for your comments that really bring in the importance of community. And that the community level involvement, and as you highlighted, particularly in outbreak diseases, but in keeping us aware of what's happening on the ground, because this is all about the individuals that are affected by these diseases, and having them be part of the part of our information system, feeding back to us, helping us understand if the program is being successful. And particularly interesting, bringing out the use of social media as a tool to help understand what's happening in the field and in the collection of information and data that can help the program understand its success or challenges. So thank you for those insightful comments, Didik. We're going to move again, jump around the planet a little bit more, and we're going to go to Mama Jima Adam, who is the head of NTD programs in the Ministry of Health and Public Hygiene in Côte d'Ivoire. And I believe he will be, for those of you that need translation, I believe he will be speaking in French. So hopefully you're hearing the translation and hearing my question magically transformed into French. What are the key strategic improvements required in Côte d'Ivoire to enable the NTD M&E system to effectively monitor program and progress towards the 2030 goals in a real strategic, way in your country?
Bien, merci beaucoup, Julie. Merci de nous donner l'opportunité de nous exprimer. Faut dire que la Côte d'Ivoire est endémique à 12 maladies tropicales négligées sur les 20 reconnues par l'OMS. 5 qui concernent les MTN à prise en charge chimiothérapie préventive, la filariose lymphatique, l'onchocercose, la schistosomiase, les jeunes métiases et le trachome. Et 7 qui concernent les MTN à prise en charge des cas tels que la lèpre, la gale, l'ulcère de Burli, le ver de Guinée, le pian, la trypanosomiase humaine africaine et les envenimations. Il faut dire qu'avec l'appui de tous nos partenaires, nous avons réussi en 2013 à éliminer le ver de Guinée. Et en 2020, nous avons réussi aussi à éliminer la trypanosomiase humaine africaine comme problème de santé publique. Il faut dire que les actions de suivi et évaluation qui sont menées après cette élimination concernent surtout le système d'alerte précoce qui est déployé à tous les niveaux de la pyramide sanitaire, mais qui intègre un volet communautaire, c'est-à-dire que la population est intégrée dans ce système d'alerte précoce. Nous avons aussi un renforcement du système par les notifications de tout ce qui est cas, rumeurs de cas, et tous ces cas sont investigués automatiquement. Nous avons des supervisions trimestrielles, des dépistages actifs dans la communauté. Nous avons une communication de masse avec la communauté. Pour ce qui concerne les maladies tropicales négligées à chimiothérapie préventive, nous avons deux volets essentiels. Nous avons au niveau des traitements de masse mis en œuvre tout ce qui concerne les enquêtes de couverture, les enquêtes de la qualité des données. Et au niveau des évaluations, nous avons, surtout au niveau de la fièvre lymphatique, pu initier depuis 2020 le pré-TAS pour 46 districts et ça va se continuer cette année en 2021 avec 33 districts et en 2022 avec 20 districts. Il faut dire que en termes d'action, nous avons aussi élaboré avec l'appui de tous nos partenaires, surtout nos partenaires Act Ouest, l'élaboration du plan de durabilité des actions du programme. Nous avons utilisé le Supervisor Coverage Tool, qui est un outil de monitorage pour prendre des décisions sur le terrain pour permettre d'atteindre des couvertures adéquates pour le traitement de masse. Et depuis un certain temps, on va dire depuis 2016, avec l'appui toujours du partenaire, nous avons réussi à intégrer les indicateurs du programme en termes de traitement de masse, indicateurs de morbidité dans la DHIS2, qui est la base nationale des MTF, enfin la base nationale de tout ce qui concerne données en termes de traitement. Merci beaucoup.
Thank you for those insightful comments. I have to turn off the translation. First off, really, congratulations to you and the amazing progress that you've made, and particularly in the guinea worm and the HAT, human African trypanosomiasis success that the country has had. And really interesting in talking about the programs moving towards elimination and eradication and differentiating out how the requirements of those programs change and evolve over time. And also reminding us of the tools that help improve programs in real time that you mentioned, like the supervisor's coverage tool that allows you to improve coverage during the time that you're doing programs and not waiting till later in the year to do that. And very good to hear, because I think this came to one of the questions we had from the other panel, which was about your integration of information into your DHIS2 program so that you are mainstreaming the NTD data into your national reporting. I would like to turn to one of your partners that's working with you, Virginie Trator and Etenge, who is the project manager. Sorry for that, was really bad. But
that doesn't matter.
The project manager for USAID's Act to End NTDs West, and she's the country representative of FHI 360 in Cote d'Ivoire. So Virginie, how is FHI 360 progressing in the intersectoral collaborations and efforts beyond the health sector? Because I know that this is an area that all of the NTD programs are working with and struggling with and learning. And how are you what are the ways in which this is the success factors you have for how this is strengthening the NTD program in Cote d'Ivoire and improving sustainability, which is what the ultimate goal is? Any thoughts to share?
Merci Julie pour l'opportunité. Nous, FHI 360, suite à l'intervention de Dr Mama du programme national que nous appuyons avec la contribution de USAID, nous sommes partenaires de mise en œuvre. Nous avons appuyé le programme pour développer un plan de durabilité. Mais ça, la particularité de ce plan de durabilité, c'est une forte composante multisectorielle. Donc, une bonne approche multisectorielle qui a été utilisée. Le programme, le pays qui est au-devant et qui conduit ce processus avec ses partenaires. Donc, ce plan de durabilité, lui, il a abouti à un plan de suivi et évaluation qui va permettre de faire le suivi et l'évaluation de la mise en œuvre de ce plan de durabilité. Donc, avec cette approche multisectorielle, les différents secteurs, les différents partenaires qui ont participé, le suivi et l'évaluation sera aussi multisectoriel. Et ça, c'est un des points sur lesquels nous avons voulu insister et qui aussi favorise l'appropriation nationale. Donc, le programme est devant et avec ses partenaires, nous travaillons. Donc, avec le cadre de suivi et évaluation pour la feuille de route, je dois dire que c'est un très bon timing que l'OMS a créé là et j'en profite pour féliciter et remercier parce que nous nous inscrivons dans ce cadre de suivi et évaluation et ensemble, avec le programme et ses partenaires, vont faire la sélection des indicateurs pour le plan de suivi et évaluation. Donc, ce cadre également a inspiré le développement du NTD Master Plan qui est appuyé par USAID et les autres partenaires au niveau du pays, sans oublier l'OMS qui apporte une contribution pour la coordination du développement de ce plan. Donc, voilà un peu en termes d'approche multisectorielle et qu'est-ce qui est aussi nouveau dans l'assistance technique que FHI 360 apporte, c'est la révision de l'assistance technique qui met au devant le pays et FHI 360 vient combler les gaps et apporter des outils méthodologiques pour faire le suivi et l'évaluation. Donc, voilà un peu résumé, Julie, notre approche et notre appui que nous avons apporté au programme ici en termes de durabilité.
Very, very interesting and very helpful in helping us see how we can practically think about those cross-sector pieces in that approach. We are running very low on time, but there's a question that could go out to many of the panelists, and I'm not sure who would like to take it on. And it's about another set of potential integration or use of tools, which is, are there any plans to use Earth observation and satellite data to monitor and evaluate progress and impacts, or any thought or interest in how that kind of level of data could be helpful to the program? Any projects related to that, or just any final closing thoughts that anyone would like to share? Anyone from our partners in country like to contribute to that? This might actually be a question that would go to Pat.
Yeah, thanks, Julie. I think that one of the really important things to emphasize is the better use of data includes using spatial data and all of the additional layers represented by satellite information. That's obviously at this point, I think I'd call it a research topic, but it's really going to be clearly important in terms of helping to improve the precision of our interventions, and especially important when we start talking about the surveillance aspect. So I thank whoever asked the question. I think it's really going to be something which is really critically important for the future. I saw that Gautam had his hand up as well, so I'm going to ask him to weigh in.
And Gautam, just a note that we're extremely low on time.
Okay, yeah. So just to, I mean, it was such an exciting question that I just couldn't prevent from getting in. I think that's an excellent question, and I think this is the area which I guess we will push Pat and his team to think about these new research areas. I remember we had some amount of environmental risk assessment for lower areas in Africa, but it has not been done in a program scale. I mean, again, another opportunity was in the water source mapping for Guinea worm. So there are definitely a lot of opportunities for use of this technology, and it is now available at a very low cost and easily. So this is definitely a way to go. Thank you.
Thanks, Gautam. So stay tuned, I think, and that there's more exciting tools to pull into play. With that, I'm going to bring us into our closing session, and I would like to ask Ivan Houghton, who is the Director of Communicable Diseases and Control with WHO MROS region, to provide some comments to us. So over to you, Ivan.
Thank you so much, Julie. I hope you can hear me correctly. And I want to thank all the participants for very insightful remarks. I really took a lot of pleasure listening to them. So I was asked to provide some suggestions in terms of a call for action. And in my function of working in a more cross-cutting way on communicable disease, I was trying to imagine if I was working at country level, I could use the framework and the information you've been sharing in your experience to try to move things forward. So I could think of three things that I would try to do. The first thing is really to own this theory of change. And I was very happy to hear the commitment of Dr. Didi from Indonesia, and also the availability of partners such as FHI in Côte d'Ivoire to really try to understand fully this logic of the theory of change from the input to the process to the outcome, and try to make sense of it because it's a very powerful tool for planning and accountability. The second thing that maybe I would try to do is have a good inventory of what is going on in my country in terms of collecting information. We've heard experiences from Indonesia working with the community. We've heard from Côte d'Ivoire the use of survey, and we've also heard about healthcare facilities. One thing that may be considered in the logic of integration is really looking at, for instance, these potential sort of community, the healthcare facilities, and the survey, and see what is already going on. For instance, for survey, it's remarkable once you go to a country, many surveys are happening. Maybe there's going to be one for EPI, maybe there's going to be one for TB incidents, maybe there's going to be one for impact monitoring pool and have an overview of what's going on in the logic of health information system governance. Then maybe we can have economies and sneak in a few NTD impact evaluation question in there. The last point I would maybe try to do is have an overview of the health information system governance and what's going on in the country in terms of
processes for data management and analysis. I heard also some experience of the use of DHIS2, I think in Côte d'Ivoire. So whether on the side of DHIS2 Health Information Management System, whether on the side of integrated disease surveillance, I would encourage our colleagues working in NTD to go out and talk and see what's going on and what could be piggybacked on for economies of scales and efficiency saving, so that this monitoring and evaluation framework and its vision of the result chain or the theory of change could be actually put to action in a very efficient way. So thanks a lot again for all your contribution. Thank you.
Thanks, Ivan. Very, very helpful and really nice seeing it put in context of your broader view of communicable diseases and how to use data. And I heard a couple of things that will reflect back on our work that we have to do at the Monitoring and Evaluation Working Group. I next would like to ask Benito Impuma, who is the Director of the Universal Health Coverage and Communicable and Non-Communicable Diseases at WHO Afro. Nice to see you, Benito. It's been a long time. Welcome.
And thank you very much, Julie. It's really nice to see you, nice to see Pat and all NTD colleagues. I'm very impressed by the number of people attending this meeting. I think we have reached more than 500 participants, which really demonstrate the keen interest in this area of work, particularly the MNE. So I have four, I would say, key messages as far as the MNE framework is concerned. The first one is really the request for countries to adapt and adopt the MNE framework at country level. There's a lot that has been done at global level. I think we will need countries to now start adopting that MNE framework at country level so that they can start the implementation process and see what is happening. So that's like the third area. And as far as the region is concerned, we are in the process of updating our NTD multi-year roadmap. And I think many of the countries beyond the region should maybe start moving towards the process of revising their multi-year NTD plans and then making sure that the NTD MNE framework can be adopted and implemented at country level. The second one, I think we spend a lot of time discussing around the importance of data. And I think this is extremely important, not only for the sake of assessing progress, but also just for knowing the burden of some of the NTDs which have been added to the list. So I think it will be the centrality of data in knowing the burden of NTD, but also monitoring progress towards the achievement of 2030 goals is extremely important. And when we talk about data, I believe there are two dimensions. The first one is really ensuring that we can invest in data collection, data management, and so on. But the second one is really the use of tools that can help us visualize the data. And lastly, beyond the collection and use of tools is really the use of data for public health decision-making at country level. So I think we need to spend some time working with our countries to make sure that data become part of our global MNE effort. The third one is really the capacity building. I think as WHO and our partners, it will be critical that we spend some time providing support to our member states, particularly those in this region, in the area of monitoring and evaluation, but also data collection and management. My last topic will really be on the financial side. It's one thing to have the M&E framework adopted. It's another one to have like the data put at the center of our efforts, but we'll need to really advocate for funds to support the global effort to M&E implementation. So I'll call on member states to invest maybe 4 to 10% of the health budget to the M&E effort so that collectively we can ensure that the M&E agenda at country level becomes a reality. So to summarize, it's really in terms of planning, adopting the M&E framework. The second one is really the effort on data. The third one, strengthening the capacity of country in that area. And lastly, ensuring that at least 4 to 10% of budget can be devoted to our M&E efforts. I'll stop there and thank you very much for this opportunity. Over to you.
Thanks, Benito. So thanks to Ivan and Benito for those wise comments in our closing. I want to thank everyone for being here, reminding the reminder that this M&E is an investment, that this is a living document that we will each be contributing to from different levels, that this is a tool to be used in country, and that we all have work to do to put this into place in order to achieve the goals of the NTD roadmap. So thank you. We wish you luck in the rest of your day and look forward to this journey with you between now and 2030.